Good evening. It's Monday, August 24th, 9:39 p.m. Take a look at some news, some numbers. I do want to mention I started working back at my old job again, so I don't know if I'll be able to post much anymore. When I get home, I'm too tired to get on this, and when I wake up in the morning, I already have to get ready to go again. So I don't know how it's gonna affect how much of this I can get out. I mean, I started this because I remember back in January watching the bodies drop all over Wuhan, people falling dead on the groceries, and I was just taken aback, and I figured to myself, this is gonna get really, really bad. And then when Dr. Lee died in February, that's when I knew for sure this was gonna get really, really, really bad, as it did. And so I just felt the need to quit my job at the time and just research this nonstop, January, February, just all the way till now. And I was posting on a anonymous board for the most part, sharing information, which is all this from the toothpaste bins. And so I made a decision just to try to inform people. I mean, I have not made a single penny out of any of this research. I'm not backed by anything. I'm not sponsored by anything. I have no following, no nothing. It's just that a few of you are passionate enough to follow my work on compiling research onto the virus. And so now that I'm going back to work, it's going to really affect my ability to pump out all this information. I mean, even like today I'm off, but I just felt so drained. It was just a blur trying to just relax because it's a retail job where I'm walking 8 hours straight, and I had been sitting down for so many months. After being there for the past 2 days, I can barely walk right now, and I mean there's a lot going on. Past couple of hours, but this is previous news. But anyways, the point is, I just wanted all you guys to be aware of this. That I'm not gonna be able to post as consistently anymore. I mean, if I could get paid to do this, that would be incredible. But unfortunately, I can't, and I have pretty much a full-time job now. So I wish I could post daily like before, but it's gonna be unlikely. Anyhow, so today's Monday. Today is what I call the eye of the storm when it comes to numbers. Now there is a more reliable website than Worldometers. I think it's called COVID Live. It was made by a young kid, some young lad, and they already tried to buy out his website, but he refused, and I think he refused millions of dollars. Now, why did he refuse? Because because he wouldn't be selling it to them. He said himself in his YouTube that he would be under a contract where he have to operate it a certain way, and so he didn't want that, so he just rejected it altogether. And his website points out what Spain is doing. Spain reported 20,000 new cases over the weekend, but under Worldometers, under technicalities, they were only reporting like I think 2,000 a day or so. But this kid's website was actually showing the real numbers, so you could see why they wanted to buy out his website, because it was more honest when it came to talking about the testing results and whatnot. So just interesting that happened. So daily cases, how's the graph looking? Merging, like I was saying. The deaths, I mean, this one's questionable right now, but we're still far, far away from eliminating deaths. Oh, these are two of these numbers. So these are two of these numbers. Let's see what's going on for tomorrow before we get into today. Oh, Mexico is already reporting low deaths. That's very low for a Tuesday, which is a good thing. Australia, South Korea, still in trouble. Kazakhstan still not reporting. Kazakhstan reports deaths, I think, only in their country. They don't report deaths anywhere else, just cases. 5 in Thailand. Okay. New Zealand still can't. Oh, New Zealand. So when it comes to New Zealand, they have become suddenly draconian about their lockdown measures. If you get infected in New Zealand, you don't get to go home and isolate. You get shoved into a facility and you're forced to do what they tell you to do until you're clear to get out. So that's kind of strange about New Zealand. And now they have 7 new cases. China, of course, lying like always. So today's numbers. Number one is India with 59,000. I think they hit a record a couple of days ago with 70,000 cases. I think it was. That's very concerning. And then again, there's a lot of reports that India is their real total is several folds more than the 3 million. Deaths are significantly higher too. If you remember back then, a journalist was exposing this, and the media outlet in India that exposed it got shut down by India. So that kind of tells you that there was some truth to it. USA second, 41,000. Now USA, the thing about the USA is people are saying that, oh, we're getting better. So here's the thing. On Saturdays, Sundays, and Mondays, cases always go down because it's the weekend. There's not as much effort in the counting the numbers, and the media always uses that as an excuse. Politicians always use that as an excuse to say that, oh, we're doing better. Well, obviously on the weekend the numbers are always lower. You can't judge the pandemic by what happens in one day. If you get a whole month straight of cases going down, then you could tell me that there's some progress being made. And even then, it has to do with issues in testing. The reason why a lot of parts of USA are having lower numbers isn't because they're beating the virus. It isn't because they found better treatments, though that is kind of working towards the deaths to a certain extent. The reason is there is less testing going on. There are these weird like glitches that are, I'm sure, some probably conspiracy that delay the numbers. So if you don't test, you don't have cases. And then the politicians, they know this, but they'll capitalize on it and say, oh, we're doing better. We're beating the virus. Brazil has 21,000 cases today. I think Brazil is going to be on a par with USA, and China as some of the worst countries to. I'm surprised no one has killed their president yet, because that man has so much blood on his hands. And talk about Jair Bolsonaro. I mean, China basically delayed the response for the entire world. The USA is lying all over the numbers and whatnot, and then Brazil just is like ignoring it. So it's just incredible. And Colombia is fourth with 10,000 new cases. So Colombia, I haven't heard much about Colombia, but it's getting there in Colombia. Argentina is on the rise. Peru is still there. Russia lying. Philippines is they're like the second behind China for the Asian countries getting hit the hardest. Now for deaths, number one is India with 854. Brazil second, 679. USA third, 510. Argentina fourth, 381. Now again, as I said many times, these numbers are not reliable. A lot of numbers are delayed days, weeks. We don't know what the actual daily cases are. And that one case website, the COVID Live one, that one is just it's a little more honest, but we don't know how bad this is right now. This entire website is just unreliable. But it's all we have, so we have to deal with it. We have to look at it. And then we have to look at the media and see what the people are saying in the countries of how it's affecting them. We kind of have to like look between the lines and figure it out for ourselves what it seems like. I mean, take a look at Ecuador, for example. They're not even on this on the top list anymore. But they were getting, they have what, 420, 12 deaths. But at Ecuador, when they got hit hard, it was Wuhan tier, and it got covered up. If you remember from the past, Ecuador had so many dead bodies. People were dumping them in the ocean. People were picking them up from one pueblo and dumping them in another pueblo because nobody wants to come pick up the bodies. People had their parents' corpses rotting in their houses because nobody wanted to come pick them up. The hospitals were overloaded. People were dying outside waiting. People were dying in their cars. It was horrible. This virus is just, it's nothing like what the media is saying about. It's much, much worse. What I want to know is why here in Los Angeles, it's not that bad. I mean, from what I've been told, it's because of the strain. We have some kind of lesser strain here. Or they're just covering up the entire thing. Because I can tell you here in LA, I hear way more emergency vehicle sirens than usual the past couple of weeks. And LA is claiming that they're doing better, but at the same time they are testing less, especially in Riverside. There was an article on a couple days ago in Riverside where they weren't testing as much. And so you can't really tell what's going on if you're not testing. And then Modoc County, the one county in California that had 0 cases, the last county that had 0 cases, they just weren't testing. And once they started testing, they got cases. So Modoc County, so California had this pride that they had one county that was never infected, and that was Modoc. And the truth came out, and it turns out it's because they weren't testing. They wanted to hold on to that for perception, but it's just this virus is everywhere. All the countries that were hailed for containing it are now suffering from it, and Europe is already going through the second wave. China is going through third, fourth, fifth wave, sixth, seventh waves all over the place. If you follow the Chinese whistleblower movements that have access to Chinese local media, they're getting destroyed by the virus right now. It's horrible. If China says they have 12 cases, it's bad. It's really bad. And it's far beyond that. Now let's look at USA. Yeah, this is going to be more of an informal video. I tend to be very straight to the point, but this time I think we're going to just hang back and talk about it. I don't know when I'm going to be able to upload another video again. I might upload it in a week or 2 or 3. I'm too busy with my job to really focus on this. I'm just too tired. If I could make a living off of doing this, and I would quit my job again. Speaking of my job, there are many cases on my job. There are people on leave right now who have the virus. It's a retail job. I can tell you, when I started, what's today, Monday? When I started on Saturday, there were customers wearing their masks the wrong way with the nose exposed. I saw a customer with the mask worn inside out. And I'm just like, wow, really? This is like, people aren't even wearing masks. People don't wear the mask till they go into the store. So that tells you that they were not even wearing a mask at all to begin with. They just have it because it's a requirement to get in. And then I'm full gear in there. I'm wearing a face shield. I'm wearing a surgical mask. I'm wearing glasses. I'm gonna get a hat pretty soon. My clothes, when I get off of my job, I put them in my trunk. My shirt, I isolate my pants at home. When I go back to work, I pick up my shirt again from my trunk. I'm very careful. I don't use the public bathrooms. I try not to touch anything. I try to stay away from people unless I have to, because it's a customer service type thing. So that's just, it's a lot of danger, because the company that I work for, so many stores have had outbreaks. It's just a disaster. People are scared. But I guess the virus isn't really hitting hard here anymore. So people are kind of laid back. So if I could bring this up, I have noticed that people here in LA have basically gone back to normal. I can't even tell you how many of my friends had family parties this last weekend. I was looking at social media, and they were just having parties, family parties, back to back to back. And I'm just thinking, man, we're never gonna get out of this, because people in LA have already moved on. That's what I'm trying to say. People in LA have already moved on. They don't care. They're throwing parties and whatnot, and I don't want to hear them cry when, this whole thing catches up to them. No, sorry for rambling, but so anyway, in terms of deaths, states in the U.S., for new cases, California is number 1 with 6,000. Texas was second, 4,000 new cases. Georgia is third at 2,000. Florida is fourth with 2,000. I just find it ironic that California is just the attitude of Californians when they're at the top of the charts. Texas, we know, was hit hard. Their furnaces were overheating from cremating so many bodies. Georgia has been there. It's like a silent type of state because it's bad there, but it's just not a lot of attention on it. And then everybody knows Florida is bad. Florida was one of the first states to get caught up in the whole lying when they fired one of their analysts for refusing to manipulate the numbers. Back in the beginning of the pandemic, I already knew Florida was bad based upon this. So when it blew up in everybody's face and became this big old problem in Florida, I already knew. It wasn't a surprise to me. In terms of deaths, California is number 1 with 105, Florida second, 66, Texas third, 59, Massachusetts is fourth, 28. Oh. So, if we go to the bottom, the military reports 1,200 new cases, 2 deaths. I really want to know who the deaths are in the U.S. military because I'm pretty sure they are all healthy, fit men, or for the most part. Veterans, 400 new cases, 12 new deaths. Federal prisons plus 44. So prisons, this thing is going rampant through all over. There's prisons like San Quentin, I think it was, where the majority of prisoners got infected. So they are covering up the prison numbers because, I mean, if we were to be honest, government officials don't care about prisoners. They don't even see them as human. The laws don't even see prisoners as human. So they're blocking out the severity of it in prisons. Even in China, we were never told about prison statistics. Never. So prisons are getting hit hard, and we're not going to know about it. Not Trump or Obama. Whoa, so stupid. Okay, so let's go to the news. Now, if you're still here, because I probably lost most of you by now, feel free to give me feedback. Like, how do you think I'm doing? Am I doing all right? Are the sources looking decent? How can I do better? So, give me 1 second. All right, so this is from 8:21. Where are we? We're at 8:24. I'm kind of behind, but been working, can't do it like I used to. So Scary Study says surviving SARS-2 is only the beginning of the fight. It is no longer about deaths. It is more about what's going to happen to the wellness of your quality of life. We're hearing, as we all know, we are hearing too many cases of people who are getting hit by this virus, and it has been causing long-lasting damage to their bodies for months. And seeing as though SARS-1 crippled many people for life, I can guarantee you we are going to have a statistic of people who are going to get SARS-2 who will be also crippled for life. And we've seen how young people have been affected this way. Young, healthy people now have heart problems, permanent lung damage, what do you call it, fibrosis. And, you know, we won't know anything till at least a couple more months because it's a novel virus, and we need to follow up on these patients to prove that it has chronic illness. And so far, it seems to do that kind of type of condition in people. But we won't know for sure till we do long-term follow-ups. But based upon what SARS-1 can do, it's pretty obvious that we are going to have people who will be crippled for life. And that's one of the things that are not talked about, as well as the brain damage. People say, oh, it has brain damage, but people don't really look to see what is the brain damage. It's severe. It's very severe. A 6-year-old girl from Hillsborough County became the youngest person to die from SARS-2 complications in Florida, health officials said. 8 minors in Florida have died from SARS-2, according to the latest health records. The previous youngest victim of SARS-2 was a 9-year-old Kimora Kimi Lenham. The girl, who had no known underlying health conditions, died July 18th in Putnam County. What? Why do they keep bringing up health conditions? It kills people with or without health conditions. Like, the only reason why they would still bring it up now is to bring some sense of comfort in people. People back in Italy, perfectly fine, young adults, early 20s, no underlying health conditions, dropping dead from heart attacks because of the virus. And they want to talk about, oh, well, this one had underlying health conditions. The others were an 11-year-old boy and a 16-year-old girl in Miami-Dade County, an 11-year-old girl in Broward County, a 16-year-old girl in Lee County, a 17-year-old boy in Pasco County, and a 17-year-old boy in Menate County. This is just one state reporting all these child deaths. You can only imagine how many children are being killed throughout the world by this virus. And it's really bad in India. As I mentioned before, India, because of the severe poverty in certain parts of India, and because of the unusual amount of young child smokers in India, We're seeing hundreds of children dying in India. No one's talking about that. Nobody cares. Everybody's looking at the 10 people the 10 kids that died in Florida. When you have kids falling like flies all over the world, many with no health conditions, many with health conditions, just people not paying attention. Like, you have to look beyond the mainstream media. You have to dig deeper than that. I guess you could say. Sex shops are seeing some interesting SARS-2 shopping trends. Globally, sex toy manufacturers and online retailers are seeing a huge SARS-2 boom. So that's just some weird humor type news, but I mean, people being stuck inside, it booms the business. The first person to publicly acknowledge the glitch in Iowa's SARS-2 reporting system said she wants more transparency from the state. The glitch was kept quiet until a public health official acknowledged it in an email just 1 week ago. I think a lot of these glitches are either states incapable of calculating their numbers or deliberate to cover up their numbers. I mean, you're looking at parts in America that are supposedly the most advanced in the world, and they're having all these glitches, and it's unexcusable. An international research team is developing a prototype SARS-2 breathalyzer machine. This device will scan the air as the patients exhale, just like current breathalyzers detect alcohol particles in a person's breath. So we're getting access to better and better and easier and less worrying SARS-2 tests. Because before it was, shove the Q-tip up the nose. And then now they're trying out these saliva tests, and then now they're doing breathalyzer. And also they're trying to do tests that can come out in just a few minutes rather than hours. But just testing is just bad all over the world. It's a shame that in America that brags over, in America where Mike Pence brags over testing, you have people waiting over 2 weeks for results. What is the point of receiving test results 2 weeks or more later? By then you've already infected a bunch of people, and contact tracers are not going to be able to trace that far back because they're already overwhelmed, and people don't even want to cooperate with them. People have to get, they're paying people to cooperate with contact tracers because they're not wanting to share information with who they've been with and whatnot. Ministers have extended the ban on landlords evicting tenants in England and Wales until 20 September, following fears thousands could lose their homes. We're going to see a humongous wave of evictions coming pretty soon, and it's not going to be pretty. The worst is yet to come. Texas, first SARS-2 recovery clinic for SARS-2 long haulers, many who are still showing symptoms months later. We're seeing things as major as strokes and amputations, and as a minor or not even that minor, where someone is fatigued and is not able to get back to exercise or has headaches. So that's good, because we need clinics for long haulers, because these people feel like no one's paying attention to them. They feel ignored. They feel like people look at them like they're out of their minds. There are long haulers. And speaking of amputations, a lot of young kids are losing limbs because of the blood clotting. The media does not want to talk about that. But a lot of perfectly healthy young people are losing arms and legs. I mean, one guy almost lost his penis. I mean, that was something that I talked about a long time ago, because it swelled up and whatnot. Yeah, this virus is just, the clotting is just devilish. Horror story. After their father dies of SARS-2, 3 siblings are left without parents. Again, another thing that the media isn't talking a lot about. A lot of kids are being left without parents. They're losing, all the guardians are dying to the virus. In Wuhan, in China, a lot of kids were just left orphans because they lost everybody in their family. All the older ones, they all died. Mom, dad, grandma, all of them died. And the kids are left by themselves. And now it's happening here. It's happening everywhere. So what's going to happen with these kids? Where are they going to go? Maine. Officials at Millinocket Regional Hospital say a person admitted to the hospital following a recent SARS-2 outbreak linked to a wedding reception has died. The hospital has not released any further information on the patient. On Thursday, the CDC reported that 32 SARS-2 positive individuals have been linked to the reception, which happened on August 7th. Yeah, my brother's getting married, and it's going virtual because this is right here is exactly what's happening. The CDC may once again collect SARS-2 related hospital data, White House Coronavirus Task Force Coordinator Dr. Deborah Birx said. In mid-July, hospitals were instructed to bypass the CDC and send daily patient information directly to a central database operated by the Department of Health and Human Services in Washington, D.C. However, speaking at the Arkansas Governor Mansion earlier this week, Birx said a revolutionary new data system is on the way, so data collection can be moved back to the CDC, though she did not specify a time frame. Right, so we already knew it was gonna happen. So the White House took over the data from the CDC, and right away data went missing. We already knew it was gonna happen. It was obvious. It's just part of the cover up. The White House claimed that they lost data on purpose to just cover up the real numbers. Oregon students, from kindergartners to high school seniors, will not see the inside of a classroom or receive in-person instruction unless the state can substantially curb the spread of SARS-2, Governor Kay Brown said Friday morning. The next big wave is going to come as a result of schools. I guarantee you that. There have been many articles, many studies that show that kids can spread the virus possibly even greater than adults. One of the reasons why kids haven't been hit that hard in certain parts of the world is because schools are on lockdown. But if once the schools get open, we're gonna see a massive Spanish wave, second wave tier type, outbreak going on. So even right now in America, where schools are kind of reopening here and there's already over 700 schools in the USA already with outbreaks. I think that's in this news or before, but it's just bad. If they're already having all these outbreaks before they officially open the country, just imagine when they actually do. And we already knew this. We already had the example of what would happen if schools weren't properly run or shut down, and that is South Africa. South Africa, their schools got demolished by SARS-2. Completely demolished, and nobody talked about it. Nobody talked about it. Nobody cared to talk about it. Nobody cares about South Africa. Nobody seems to care about Africa in general. Like, Africa needs to be looked at. It pretty much showed you that what happens to countries that don't properly prepare for the virus. Nigeria went under chaos months ago. People were robbing the A trucks. People were robbing the stores by the dozens, just looting them. But the most important thing, not the most, but one of the most important things lessons that can be learned from South Africa is that their schools got ravaged by SARS-2 early on. So we already knew it was gonna happen, and I'm pretty sure that the governments of the other countries know this, but they wanted to open them up anyways. And now we're seeing humongous outbreaks in America before schools officially reopen in the country. So you can only imagine how bad it'll get once they do. Riverside County, California. The number of Riverside County residents who are getting tested for SARS-2 is declining, and officials are urging people who have not yet been tested to do so. Over the last 2 weeks, the testing has been down tremendously, according to Riverside County Emergency Management Department Planning Chief Brian Tisdale. Yeah, as I'm saying, you can't fool me and tell me that cases are going down in America. Why? Because I know what's going on. I know because it's not that cases are going down. It's that testing is going down. And at the same time, even though testing is going down, positivity rates are still going up. So it's all a game. And you gotta see past it. It's all a game. Germany. Germans hold simulated pop concert packed with volunteers to test how SARS-2 spreads at events. The results of the study are expected in 4 to 6 weeks, he said. Now, if this doesn't get banished in memory hold, it'll prove some very scary results. So I'm looking forward to what this is going to expose, assuming that doesn't get covered up. Germany's Disease Control Center reported 2,034 new cases of SARS-2 on Saturday, the first time the daily national increase has topped 2,000 since the end of April. The Robert Koch Institute said SARS-2 outbreaks are being reported in nursing homes, hospitals, schools, and especially among travelers and in the context of religious or family events. In Berlin, one of the first states to return to school, at least 41 schools this week reported that students or teachers have become infected, and hundreds of them have been put in quarantine. Europe is in wave 2. Full-fledged wave 2. And Dr. Eva Lee told us that in April, based upon her models and predictions, that they'd be in wave 2 around, and they hit wave 2 when she said they would. And she was right on the button. And Europe is now in wave 2. U.S. In California, the ongoing pandemic and social distancing restrictions are yet again complicating disaster relief efforts as more than 100,000 Californians flee raging wildfires. California government Gavin Newsom said evacuation centers across the state had protocols in place such as marked spaces for physical distancing in shelters, indoor tents, temperature checks, and individual instead of communal meals. Meanwhile, efforts to reopen schools nationwide are being complicated by the virus data problem. Yeah, so California's getting hit by a pandemic, and now getting hit by a forest fire, or multiple forest fires. I think they said it was the size of the. They don't mention it here, but the amount of fires in California cover an area as big as Rhode Island. I've never heard that before happening here. Luckily, I'm not near any of this nonsense. House of Representatives passed legislation Saturday to prevent any further changes at the United States Postal Service and to provide $25 billion in funding ahead of an expected surge in mail-in ballots in the November election amid the ongoing pandemic. Excess deaths. As many as 215,000 more people than usual died in the U.S. during the first 7 months of 2020, suggesting that the number of lives lost to SARS-2 is significantly higher than the official toll. Now this is obvious. It's as wet as water. And I said this before many times, if you want to know the real deaths, look at the excess deaths. Look at the death toll for countries right now and compare them to where they were in other years. And there are just hundreds of thousands of people who died more than expected all over the world compared to the other years. And I bet you it's because of this virus, either directly or indirectly. In fact, the death toll, in my opinion, should already be in the millions. It's just so far behind. Churchill Downs will no longer allow fans at the 146th Kentucky Derby, though the iconic horse race will still be run. Health officials say Bar Hopper at Sturgis motorcycle rally tests positive for virus. If you remember, this motorcycle rally had, I think they said, hundreds of thousands of attendees. There is no way they can contact trace this, and there's already several cases being confirmed out of it. You had a bar hopper passing on the virus. There's going to be some nasty aftermath from this rally because people don't want to quit obsessing over the motorcycles. South Korea reimposes ban on large gatherings, closes beaches as virus threat returns. South Korea, which is in spring, has celebrated hard-won gains against SARS-2, is again banning large gatherings, closing beaches, shutting night spots, and churches, and removing fans from professional sports in strict new measures announced Saturday as it battles the spread of the disease. While most of the new cases come from the densely populated Seoul metropolitan area, which has been at the center of the viral surge in recent weeks, infections were also reported in almost every major city and town, raising concerns that transmissions are slipping out of control. No surprise, they have a death cult type of religion there that was deliberately spreading the disease. So South Korea, as hard as they tried, they failed. California, with less money and more risk, waves of childcare providers call it quits. Since SARS-2 shut down the state in mid-March, financial losses, concerns about exposure to the virus, and navigating a maze of new safety guidelines have forced some 9,300 licensed child care providers, almost 1 of every 4 in the state, to close. According to data from the California Department of Social Services that shows closures through July 31st, more than 1,200 of the closings are permanent, eliminating roughly 19,000 child care spots. The state figures show there is no way to know how many of the thousands of others that have shut their doors during the pandemic will eventually reopen, or when, leaving the full effect of pandemic on child care uncertain. A recent survey of the Center of American Progress estimated that California was at risk of losing more than half of its available child care slots. The pandemic has left child care providers with 2 bad options: closing and joining the ranks of the unemployed at a time of deep uncertainty for the U.S. economy, or remaining open and putting themselves and their families at risk of exposure to the virus. That's coming from an LA Times article. Again, where is what? This is something that should be mainstream. I mean, but it's no surprise that it's not, because the mainstream media controls the narrative, and they're trying everything they can to mislead and misinform the people. People can't work if no one can watch their kids. So on top of a failing economy, and top of rising unemployment, people can't even work because of the care centers. No one can watch their kids. No, I mean, I'm sure there's people that are forced to leave their kids home alone because they need the money, but that puts a child in danger. It didn't have to be this bad. If anything, if the government, which never cared about its people, actually did, they would have bailed out the child care centers. But instead they're basically bailing out the banks, bailing out the billionaires. The pandemic has So additional, Ohio, 34 University of Toledo students have now tested positive for SARS-2, as students and the school's president have expressed concern about large off-campus gatherings. Every day, multiple schools report cases. Every day, staff, teachers, students, they're already talking about school buses. It's just ridiculous. U.S. A member of Congress who represents part of Berks County has contracted SARS-2. U.S. Republican Dan Muser announced in a press release late Saturday afternoon that he has tested positive for SARS-2. Now, a lot of people are going to tell you, how come nobody significant has died from the virus? How come nobody really famous or really influential has died from the virus? Well, first of all, obviously you don't care about all life to be talking about like that. And then second of all, the people who have money have access to the best healthcare system in the world. Government officials are taking hydrochloroquine. So of course they're not gonna be dropping, because they're lying to the public while taking the type of drugs that they say don't work. It's the poor who are dying, because they don't have access to great healthcare. They don't have money. They're not informed about taking hydrochloroquine with zinc. They're not informed about vitamin C, vitamin D, boosting the immune system. They're not informed about any of that. It doesn't even matter that I report this, because because this man's probably taking hydrochloroquine. He's probably got the money stashed away for the best healthcare. I don't expect him to die unless he just died unlucky. The virus decides to just take him. UK, missing school is worse than virus for children, Professor Whitty says. Sure. Update. Maine CDC now links 53 SARS cases to Millinocket wedding reception. 1 death so far. Yeah, so the wedding I talked about before, it went up to 53 cases now. Many hospitalized. I think 3 are in ICU. Another warning. The twindemic approaches. Public health officials fear the scenario of both SARS-2 and influenza as we approach the flu season. Again, everybody should be alert about this, but the coming twindemic. What's gonna happen when people with SARS-2 start catching other viruses and they combine? It's gonna be devastating effect. So there should be more attention about the incoming flu season, or I guess the twindemic as it says. So I guess that's kind of where we are right now. It's dragged on longer than it was supposed to. I don't know when I'm going to be able to update again, just because I have so much going on. I mean, there are other people that are posting. I mean, Peak Prosperity, he's sort of declining because he won't stop talking about immunity and these weird XYZ theories that they don't make sense to me. A lot of people seem to go to Dr. John Campbell, who is actually a male nurse. He's not a doctor. He claims to be. He was on a news program where the anchor called him a male nurse, or I guess a nurse, which he is. So he needs to drop the whole doctor thing. A lot of people like to say the doctors for credibility, but they're not even doctors. And he's one of them. He has a huge following, but my problem with Dr. Campbell is that he's afraid of criticizing China. And I talked about that many times before. He was defending China, actually. And he knew it, and he admitted that well, he basically said guess stuff to his fan base. Because he kept getting called the China show, which he is. He moves very slow. He moves at the pace of the mainstream media. He just regurgitates numbers and official data. I don't learn I don't learn anything from his videos. I mean I'm not an expert. I'm not an academic. I don't even know what I'm doing. But I can do enough self education and enough research on my own to know that this man is somewhat of a fraud. But I mean, as long as people, I guess, try to take his advice, and I mean, good and all. But he could do much better. He could do much better. There are things he should have been talking. He should have been talking about months ago that he didn't. And then so there's him. Then there's Pete Prosperity. There's Jennifer Zhang, but she is very bad at reporting because her content is very short. There's no context a lot of the time. Who knows what she's up to? Uh, and then another thing that was strange was that Steve Bannon got arrested. So Steve Bannon is part of that group of people, including Miles Guo, who are part of the Chinese whistleblower movement. They are top enemy for the CCP, the Chinese Communist Party. And Bannon got arrested. I think they're probing Miles Guo. So that's a very interesting story I'm going to be keeping up with. And then there's Dr. Li Menyang, who kind of hasn't been saying anything lately. I'm still waiting on her paper. I hope that she doesn't disappear. And then there's me, who went back to the retail job, and I'm kind of, my wings are like Dr. Everly said, my wings are kind of clipped at this point. But I'll do what I can. I don't know when I'm gonna upload again, but I just gotta figure out how I'm gonna manage this, because I'm just so tired from my job. I can't do this like I used to. Anyway, thanks for listening. This is a a very long video. I just had a lot of other things I wanted to talk about. Anyhow, thanks for listening, and I will see you in the future.